right, so I'd like to welcome everyone to this well session. Today we have Christina Flavin with us. She is a physician's assistant in dermatology at Dartmouth Hitchcock in Manchester. She's a graduate of Northeastern University, physician's assistant program there. Christine has worked in a variety of settings, including emergency medicine, internal medicine, and for the past 22 years at the dermatology department at Dartmouth Hitchcock in Manchester, which she knows is home, which is wonderful. Christine diagnoses and treats a variety of medical conditions in both children and adults, and performs numerous procedures, including biopsies of potential skin cancers. Christine works closely with the physicians in the dermatology department to provide complete and comprehensive care to all their patients with a strong focus on education. And she's happy to be here today to talk with us about skin, UV, everything under that umbrella. So one housekeeping note, if we could keep questions till the end. TV is recording this session, and they've asked that we try to do that so that we can move a mic around so that those that can't watch this or be here for the live that watch it will hear those questions. So, Christine.
Thank you. So thanks for spending your lunch hour with me today. Like she mentioned, I've been in dermatology now for over 22 years. I have a lot of experience in diagnosing and treating skin cancer, but we really want to prevent that from happening. So I'm going to go through a few things today. This is very casual. I'm not here to preach. I've been sunburned myself. I did use tanning beds for a short period of time. So, I live and learn. So, and this is my first slides presentation I've ever done. Back in the day when I was in high school, we didn't have this kind of software. So if I mess things up, just bear with me. It's pretty simple, but I hope it gets the point across. So here's the sun. It's your frenemy. We love the sun. It makes us happy. It keeps us warm. It helps things grow. It helps provide some vitamin D that we do need. There is a debate in the dermatology world about how much sun is good sun. There's some dermatologists who just say nothing. It's just sun is bad. It's a known carcinogen. Don't go out there. Other people believe that 15, 20 minutes of natural sunlight is very good to help with your vitamin D. I kind of fall in the middle ground. Get outside, just be smart, don't burn to a crisp. We do know that photo or ultraviolet light is a carcinogen, so it is a known contributor to skin cancer, and it also accelerates the aging process. So when I have young kids in the office, they all think they're invincible, so I don't harp so much on you're going to get cancer. I harp on you're going to have leather, disgusting, blotchy skin, right? And we see movies like something about Mary with just that lady down there with the blonde hair, the leather skin. It's gross. So the culprits here are ultraviolet A and B light. There is a UVC, but that does not penetrate through the atmosphere, so we don't have to worry about that. UVA contributes to the aging process, wrinkles and sunspots. Some people call them liver spots, but those are the brown splotches that we see commonly on the face, the chest, the arms. Yeah, we all have them. UVB, that will give us sunburns and damage the DNA of our cells, which can then contribute to the skin cancer. And you'll notice in that little diagram, the sunscreens will reflect or prevent the absorption of the ultraviolet A and B rays. Most sunscreens now are broad spectrum, meaning they will block both A and B. So the fountain of life, the sun is not. Sun damage is cumulative. So some people say, well, the damage has been done when I was young. Why bother now trying to keep myself healthy? Well, only about 23% of the damage was done before you were 18. So you can make big improvement by starting at any point. Yes, there is some damage, but going forward, use the hats and the sunscreen and you can make a difference. 80% of visible skin aging in Caucasian women is caused by the sun. So we're always looking for this fountain of life and trying to look younger. Biggest thing is protect yourself from the sun. And of course, it decreases the risk of melanoma. So on the left side, these are identical twins. One twin, she did a lot of indoor work. She was a professional, wasn't outside very much, was good in the sun. Her twin on the right there loved the sun, loved the beach, was also a smoker. So you can see the difference in their skin tones, the blotchiness, the decreased elasticity of the face. And the man that's on the right, his profession was a truck driver, and you can see his driving side is significantly more wrinkled and thickened because he didn't use his sunscreen. So indoor tanning needs to stop for most people. There's a caveat to that, which I'll talk about in a minute. But you're basically in a pressure cooker in a tanning bed. And it's been the rage for a long time. I admit I did it for a short period of time and was stupid. But it can really fry your skin quickly. And it can also increase your risk of ocular melanoma. That's melanoma in the back of your eye. Even though you wear those little goggles, it's not 100% effective. There's a big increased risk of melanoma in patients that have used tanning beds. And some of my first melanoma patients when I joined dermatology were young women around, under the age of 35. That to me was a wake-up call. Melanoma can be deadly. We, as dermatologists, do, however, sometimes recommend a tanning bed or a tanning booth for patients with severe eczema or psoriasis or even intense itching. There is something about ultraviolet rays which can help those conditions. There are a lot of new medications now that we can use in place of tanning, but there is a small group of people that we may recommend get a little bit of tanning. But we're not telling them to go get a bronze tan and as their skin rashes clear up to stop at that point. So sunscreen, it's your armor in a tube. SPF stands for sun protection factor. Bare minimum, you should do a SPF 15. And if you can get it in a moisturizer that you use every day, winter, spring, summer, fall, that will block about 93% of the ultraviolet rays. That's a great way to start. If you really want to step it up a little bit, 30 SPF would be great. And there are plenty of moisturizers out there too that you can just incorporate into your daily routine. If you really want to go for the gusto, 50. Blocks about 98%. So you see by increasing the SPF, you're not greatly increasing the percentage of ultraviolet rays that are getting through. I typically don't tell people to get 100 SPF, even 70. Those tend to be really expensive. They're more irritating on the skin. So top it off at a 50, and no matter how high your SPF is, you still got to reapply it every 2 hours. And you want to do broad spectrum, UVA and UVB. There are two types of sunscreen. Mineral and chemical. So mineral sunscreens are the ones we are most likely going to recommend if you come to dermatology. Mineral sunscreens tend to be the pasty, thick stuff, although they do make clear mineral sunscreens. Those still are a little bit thick, but they provide immediate protection. As soon as you put them on, they reflect the ultraviolet rays. This is not being absorbed into the skin, it's providing a barrier. It tends to be they're very gentle. So for kids and babies and people who have sensitive skin, we recommend the mineral sunscreens, which contain either zinc or titanium dioxide. They have a very long shelf life, longer than the regular chemical sunscreens, so you don't necessarily need to throw them out every year. And they're environmentally friendly. If you travel overseas, a lot of places will say we need reef-friendly sunscreen, and those are the mineral ones. The cons, they're thick, they're pasty, they're hard to spread. They're not as water resistant as the chemical ones. When I had kids when they were little, I would pin them down and we would put the mineral sunscreens on first, get that thick barrier on there. You can see if you miss a spot. And then going forward, typically I'd be chasing them on the beach with like a chemical spray just because it was practical and easy. The chemical sunscreens, those are the ones that used to be all the rage, but now again we're shifting more to the mineral. They're lightweight, they're easy to apply. You can get them in a variety of applications like the powders and the gels and the sprays. They're very good with water resistant and sweat resistant. But they're chemical, and they can cause a lot of irritation in patients who have sensitive skin. Also, there's some absorption concerns in the skin. I'll get to one thing in a minute, but just in terms of like if you have a spray, you're not sure if you're evenly distributing that all over your body. So I like the creams, I like the lotions that you can really get a nice even spread on your skin. There's been some environmental concerns about the chemical sunscreens, and again, that's why if you travel overseas, they really want you to use the mineral ones. And they're not immediately effective. You gotta put them on about 20 minutes before you head outside. I always cringe when I'm at the beach and see people start, putting the spray on. that's got to sit for a while. It's not going to do any good right away. So it's got to be absorbed down into the skin so that it can provide the protection you need. So the elephant in the room, on social media and all over the internet now, everybody's saying, oh, sunscreen's bad, it can kill you, it'll give you cancer. There's been no studies that prove this at all. We know that sunlight and ultraviolet rays will kill you and cause cancer, but sunscreen, we're not there yet. I'm glad that the discussion has been opened about chemicals that are in products that we're using and in foods that we're consuming, but right now, I still recommend the chemical sunscreens. Now, some of the studies done a while back showed people who were using sunscreen, the chemical sunscreens, head to toe every 2 hours over a long period of time. There was some potential for those chemicals to be absorbed into the blood, and then thought that maybe that could lead to a cancer down the road. I don't know anybody that puts that amount of sunscreen on regularly to cause these kinds of concerns, but they're investigating it, and that's good. Mineral sunscreens are much safer, but there's also been stuff on social media lately about mineral sunscreens being bad. And from what I've read, the concern is some of the little nanoparticles of the plastics that might be found in these that could cause problems. But it was in the aerosolized versions. So if you really just want to play it super safe, just use the mineral sunscreens in a cream or lotion form. But don't not use sunscreen. And you have to make sure you're applying enough of it to work. So on average, a shot glass full of sunscreen should be what you're using to cover your entire body, and reapply every 2 hours if you can, especially after swimming or sweating. Again, it's really hard in kids. You know, I used to be really good about educating people. You got to do this every 2 hours. Then when I became a mother and had kids at the beach, that doesn't happen very easily. You get them before they, put it on before you leave to go to the beach. And then if you're lucky, you're chasing them down, trying to spray stuff on. Kids don't want you smearing it on when they have sand all over them. So that's where the hats and the jackets and the, long sleeves come in, the umbrellas, the shade. Use common sense. I mean, stay out of the sun at high noon if you can. Wear your sunglasses, find the shade, stay hydrated. The sun protective clothing has come a long way. They make really nice hats nowadays. Hats are very important. The top of your head is the first thing that receives the brunt of the sun. So get the hats on. And it will also help your nose, your ears, everything. And like I said, they've come a long way with hats now. So there's a lot of good stuff out there. No sunburn is good. So we've all burned. I've been there. My sister and I used to have competitions to peel off the biggest piece of skin after a sunburn. So don't burn. Anyone can get a sunburn, even if you have darker colored skin. There are some things that increase your risk of sunburn, certainly the time of day that you're out and how long that you're out. If you're on certain medications, doxycycline is a big offender, nonsteroidal anti-inflammatories, Motrin, naproxen. Bactrim is another antibiotic that will increase your risk of burning. Diuretics, hydrochlorothiazide is a big one. Retinoids, people who are using retinol or Retin-A, that can increase your risk of sunburning. People on Accutane for acne, that is another big photosensitizer. The intensity of the ultraviolet rays, so if you're down on the equator, it's going to be a lot worse than if you're up in Canada. So just kind of be smart and think about that. And also, the ozone layer around the equator isn't as thick and protective as what you'll find up in the South and North Pole. So again, that's why you just really got to be diligent when you're heading south on vacation. Skin type. We in dermatology rate your skin type. So the first thing when people come in for a skin check, my first thought is what skin type? Skin type 1 is fair skin, freckled, red hair, bright blue eyes. Those people just burn. They never tan. Skin type 2, not quite as sensitive, but still they tend to burn easily. Skin type 3, you might burn the first big exposure of the summer, but you tan the rest of the time. Skin type 4, you tend to have olive toned skin. Skin type 5 is very dark skin. But even dark skinned people can sunburn and get melanoma. We call it nature's regret tattoo. It's really not worth sunburns because 5 or more in your life will double your risk of melanoma. Melanoma will kill you if you don't catch it early. So regular use of an SPF of at least 15 or higher can dramatically reduce your risk of melanoma. This last little tidbit is interesting. So a lot of people who come in with moles that they've had since childhood or birthmarks, sometimes they're like, oh, you got to take this off. I'm worried it might turn into melanoma. Most melanomas arise on their own and not within a pre-existing mole. So I can only recall maybe 1 or 2 patients in 22 years that actually had a birthmark that started to change. Most melanoma just kind of comes up on its own. And we call it the ugly duckling. So we have our certain criteria that I'm sure you've heard about, the A, B, C, D, E's of melanoma, what you're looking for in terms of a mole that's not good. A is for asymmetry. It's usually irregular. The borders are jagged and notched. The color is very variable within it. You might see pink and black and brown in the same mole. Diameter, 6 millimeters or more. Ideally, you want to catch it before it gets that big. Evolving, it's changing, it's growing, it's not just sitting quietly. So stability is always a reassuring sign in a mole. Something that's just sitting there is usually very reassuring. Some patients that come in, every mole they have will meet these criteria. They'll be all asymmetrical, irregular, variable colors. So for me, the way I was trained is take a step back and look for the ugly duckling. Look for the one that stands out, that doesn't look like the rest of the bunch. That's the one you want to focus on. Melanoma sometimes will also bleed or scab or ulcerate or get really itchy or painful for no rhyme or reason. So something that's misbehaving is what you want to look for. And here's some examples. So the top row are normal moles, but if you look carefully, some of those moles are a little irregular. That second one in, we would call that a fried egg. Its center is a little bit darker than the rest, but it's okay. But melanoma on the bottom, you can see a little more dramatic, irregular, jagged, different colors in the same spot. And those will grow and change. And so thankfully, some of the patients I've seen recently with melanoma have noticed a change. They've said, the spot on my arm's really changing. Thank God you noticed, because it was an early melanoma. The issue, too, with melanoma is it grows deep, it hits the bloodstream, and it can metastasize. So you want to get it while it's still in that top layer of skin, because once it hits that bloodstream, it's hard to treat. In our department, you really want to try to get that melanoma before it hits a 0.7 millimeter depth in the skin. 1 millimeter deep or more, you definitely have to send them to have their lymph nodes checked, and it's a much bigger process. Less than 0.7 millimeters, usually surgery will get it all out and you don't have to go down that road. Tiny, yeah, 0.7 millimeters is very small. And then there's a gray zone, like 0.7 to 0.9, and a lot will depend on what it looked like in the patient's history, whether or not we send them to have their lymph nodes checked. But early detection's the key. The most common one we see all the time is basal cell skin cancer. That's a superficial skin cancer. Really doesn't metastasize. It sits there in that top layer of skin and gets a little bit bigger over time. A lot of people think it's a pimple or a bug bite because it's kind of pink and round and shiny, but it doesn't go away. And so the classic textbook presentation, someone comes in, I've had this pimple on my forehead for 6 months, and whenever I wash my face, it bleeds a little bit. Well, pimples usually go away. And something that doesn't heal, we always, in the back of our mind, think about basal cell skin cancer. Oops. Let's see. You can see on the top here some different pictures. I had another slide, but it seems to be gone all of a sudden. With common basal cells. So you can understand how people would think it's just a pimple or something, but it usually starts to misbehave a little bit. It might itch or bleed a little, but they're very slow growing. Squamous cell is another one we see, a little more aggressive than basal cell, but not as deadly as melanoma. That too will definitely be triggered by the sun, but also in patients who are immunocompromised, whose immune systems aren't as healthy, they will have a higher rate of squamous cell skin cancer, and even basal and melanoma, because your immune system is very important. Usually this is more of a scaly, tender, sore, typically sun-exposed areas, sometimes warty-like, but it's angry, usually a wart might just sit there, but this usually is pink and it's uncomfortable and may bleed or scab. And again, early detection's the key. Surgical treatment usually does the trick. And here are some more pictures of typical squamous cell skin cancers. A rare one that I just threw up here, Merkel cell carcinoma. This is the one that Jimmy Buffett died from. Very rarely do we see Merkel cell, but it's very bad if you have one. Typically on the face then or neck, usually looks like a pink, purple, red nodule. Sometimes it's thought to be a cyst, but this one metastasizes quickly and can be very aggressive. In my years of dermatology, I've never diagnosed one, but I have 1 or 2 patients that have had a history of it, and pretty extensive surgery had to be done. So here are some lies that we tell ourselves. Melanin is my natural sunscreen. So if you're darker skinned, if you're, Italian, oh, I don't need sunscreen. I never burn. Well, it's still doing a number. You can still have skin cancer. You will still accelerate the aging process. Tanning beds are safer. We talked earlier about how that's not true. Thought my makeup was enough. It's got SPF in it. It's better than nothing, but again, it's only on your face. It's probably not spread evenly, and you got to reapply it. I only burn once, then I tan. You don't want to burn. It's cloudy out. I don't need sunscreen. Ultraviolet rays do come through clouds, and I think we've probably all been on one of those days where we thought we didn't need sunscreen, went out on a boat or something, and then you end up with the burn. And reapply, you got to do it. I admit I'm not good with every 2 hours, but I try to do it at least once or twice if I'm out the entire day at the beach or something like that. So the bottom line, get outside, have fun, just don't be stupid. Very simple. So thank you for listening to me today, and if you want, I can take some questions. Oh, let me grab the mic, just so I don't get trouble by those at the TV station door. Correct. Mineral. Yep. Pardon? So these that we have samples of are, I believe, are the chemical ones. And truthfully, what I use every morning is a chemical sunscreen in the moisturizer. But if I'm going out for, to the beach, or I'm going to be outside all day, I like the mineral ones. They're less irritating on the skin. They provide a physical barrier. So they're thicker, they're harder to run in. But in this day and age, where we're worried about what's in the products we're using and some of the chemicals, if you really want to be 100% safe, just stick with the mineral. It usually says it on the tube, so it will say mineral. Those are chemical. When you go to Walmart, or Target, they usually have the sunscreen separated, so it'll say mineral sunscreens, and then usually it'll just be the regular stuff. But I have seen in those stores that the mineral ones are separate. And you can look, it'll say reef friendly, or that's another indication it's a mineral sunscreen.
Any other questions? Oh, here we go. I'm going to give you that. There you go.
I'm reading some stuff about UV helping with cell biomechanics and the clearing of the. So there's other benefits of UV to the cells.
Different wavelengths. So maybe are you thinking like the red light treatments that people are getting?
I'm not sure if it was UV red or if it was something else.
Yeah. So I get that a lot. Red light is this thing that everybody's talking about now in dermatology. They use it for everything, for acne, for hair regrowth, for rejuvenating your skin, all this kind of stuff. And I read an article a couple of months ago because I had a lot of patients asking about it. And what I read was, it looks like it's something that we're going to be recommending in the future. It's showing potential for a variety of different things, but we're not really sure how it works and long-term side effects yet. So my takeaway from reading that article was I'm going to hold off on recommending it to anybody because there's more information that we need to find out about it. I know plenty of people that do it. You can buy over-the-counter units. You can buy stuff for your scalp, little helmets that you wear to help rejuvenate hair growth. It's like $1,000 for those little helmets. But until I see some more solid data and more widespread use where they can take a larger patient number and make recommendations. I'm just watching from the sidelines. So I think that's probably what you're talking about, those kind of the red light treatments.
Cool, thank you.
Any objection to like those self-tanning creams and stuff?
Yeah, no, that's a very good point. No, actually. I was always a little leery. I'm like, what on earth is being used in those? It's got to be found to be deadly at some point. No, it's just very superficial little staining of the skin. It's not getting absorbed at all, sloughs off over time. So they've come a long way. It's not the orange smear anymore, right? You get the spray-on stuff. So if people really want that golden look, get the spray tan. We have to start thinking like pale is pretty. That's where we need to go. And if you think like Nicole Kidman, she's beautiful. She has that porcelain doll skin, but our culture, our media doesn't promote women that have that beautiful pale skin. It's all the tan. So we've got to switch how we, what is true beauty. And right now it's tan. But anybody else?
Anyone else? All right.
So we have there's some coupons and some samples here and some information about sunscreen and how you choose it. And there's different types of like water-resistant sunscreens and different gradings, and some of these papers explain all of that stuff. But like in my practice, I try to keep things really simple, because once you get really complicated, people just lose you. And like the final slide says, just don't be stupid. Just cover up, don't burn to a crisp, but have fun. Get outside and enjoy the fresh air.
Thank you, Christine. So that concludes today's presentation. I'd like to thank Christine for coming and sharing her knowledge and experience with us today. Very important for all of us to take this information, apply it where it is applicable in our own lives, but then also with other influences within our lives. If we have children, grandchildren, friends, spouses, showing that you have, that concern for their health and well-being with the sunblock is important. Thank you to everyone who,
How often do you recommend dermatologists looking at your skin?
So the American Academy of Dermatology recommends everybody have a skin check once a year. If we did that, we would have no appointments for anybody with eczema or acne or anything like that. So you kind of look at your risk factors. If there's a strong family history, if you've had a lot of burns in the past, if you're skin type 1, really fair and freckled, certainly you would want to come in once a year. For people that aren't high risk, usually I'll say, when you go for your physical exam with your primary care doctor, ask them to look at your skin. And if they see something, definitely they can refer you to dermatology. But it's also you as a consumer, if you feel more comfortable coming to dermatology to check your skin, then we will see everybody, we welcome them. But definitely, if you have a first-degree relative with skin cancer, especially melanoma, if you have a history of skin cancer in the past, if you are on immunosuppressive medications like Humira or prednisone, methotrexate, those types of things, you should be seen every year. One other thing I wanted to mention that I didn't earlier about melanoma. Melanoma can occur where the sun doesn't shine. Melanoma can be in your eyes. It can be in your mouth. So your eye exams, your dental exams are important. It's rare, but it can happen. Melanoma can be in the genital area. It can be between your toes. It can be on the bottoms of your feet. So it's rare, but you got to have all those areas checked by somebody at some point. And because, again, early detection is the key. Okay.
Thank you. Yes, definitely coming from a family of with melanoma history, it's super, super important. And as you mentioned, my daughter was actually one that had a mole that turned into a melanoma. And it was my husband who always played with her and watched, and all of a sudden one day he said, "Christy, you know what, that looks different." And it prompted a trip to the doctor, to the dermatologist, and then on to Boston we went. So good today, but let me tell you, it changed our whole perspective as a family, and hers definitely on skin care. Like to thank everyone who did take the time out today to come. Your commitment to your wellness and the wellness here is super appreciated. It puts tools in all of our toolboxes so that our journeys can be that much easier for all of us. This is great knowledge, so thank you again, Christine, for sharing with us. Want to thank the TV team. We couldn't do this without them. They help us with the recordings, with the videos, and allow all those that couldn't come to the live session to still have access, which I think is critical to our wellness programming here at the city. We want to take those barriers, or as many of them, away as we can, so having the recordings is fabulous. Our next well session is going to be here in this room on August 12th at 12:30. We are going to have Jacqueline Fodor, who is a registered dietitian with us from Nutrition Counseling of New England. She's going to be discussing getting back on track after summer with our routines. Do you have a question?
Yeah. Can you speak about health coverage on preventative care or visits?
Yep, we'll come back to that. So with that discussion, we're going to talk about getting back on routine, how we're going to fuel our bodies, as we get back on routine, how we can pack those healthy little snacks, make those snacks at home that aren't processed for ourselves. So Jacqueline has many years of experience, so if you can make it, we'd love to see you. So with our insurance here at the city, so we have Anthem, and my understanding is if you have, every year we go for our annual physicals, and you see your PCP. If your PCP identifies something on you that looks concerning, they'll do the referral over to a dermatology office for you. Then you'll go through that treatment with that. Kath, is there any more you want to add to that?
So what plan you have, you can go, I've gone with referral, even though I'm in HSA. HSA would not need a referral.
You wouldn't, yeah. But oftentimes, you don't need it for the HSA. The HMO you would, but again, oftentimes that's how the whole process starts. It's you being referred by your PCP. Most people don't just go on their own. It's usually someone that identifies something that's triggering that would then prompt that, visit to go over there. And then that care continues. And then once it's identified, it's in your history, and you go every, as.
And I don't believe, it would not be a routine.
No,
It as routine, it would still be
Yep.
a medical exam.
Yeah.
It's not routine.
Yeah, so but if you're looking for clarification, what I can do is I can snip it from our information that we have from the carrier on that piece specifically and send it out to you. So, yeah. Because it is definitely, I think, for all of us nowadays, with everything being as expensive as it is with healthcare, it is important to know how we're gonna, go through that. I know for me, it's in my history. It's just now a part of my routine. So with the annual physical, I know that I'm gonna have that annual skin check, and I go every year for mine, just because of the history. So, but definitely we can get that information out as a follow-up on that as well. So, anything else before we conclude? All right, thank you guys